Hello, my name is Dr. Sana Khan. I'm a radiologist at Expert MRI. Today, I actually wanted to talk to you a little bit about whether position or weight bearing matters when you do an MRI. And I guess the basic question would be is whether gravity matters. So, which I think we all know it does. You have to think about gravity, and you have to think about different injuries and in what position they occur, or they're more symptomatic. When you have a patient that's hurting in a certain position, you should really scan the patient in that position. So if a patient is hurting when they are sitting down with weight bearing, then you should sit them down and scan them to be able to see the full extent of the injury. If patient hurts when they're flexing or extending or lateral bending with the neck or the back, then the likelihood, and this is published research, of the pathology being caught is more than 50% that otherwise would be missed. Where if you have a patient, say let's say it's a tennis player, they go to serve and it hurts when they go up here. The likelihood of the rotator cuff tear showing up is much more likely in the position that's causing their symptoms versus laying down. So it's really it's not that complicated of a fact. It's important that the patient let the doctor know that they're having pain in a specific position, because then the doctor can actually request for a positional MRI and get you the best possible results. So what we like to do at Expert MRI is to scan the patients, do the MRI in that position in which the doctor is also feeling that the patient has the most symptoms and where the patient is experiencing their symptoms the most. This way we can give back clinically correlated images to the doctor. So if a patient comes to the doctor and says, "Doc, my back really hurts when I bend this much right here, right here." Well, we can actually scan the patient in that position for the doctor and for the patient. This machine that it's called has different names. Sometimes it's called stand-up MRI, sometimes it's called upright MRI, positional MRI. This machine actually has its magnets on the side. So it's a front open design, allowing the patient to be in different positions, flexion, extension, lateral bending. So a lot more flexibility with this new technology than we had in the past. So therefore, it's a much better way to diagnose your patients. And research published has already says that if you do not scan the patient in the position of symptomatology, you will miss injury that's causing the pain more than 50% of the time. So hopefully this is helpful. Thank you. Have a good day.